do we evaluate a couple when they come to an infertile clinic? Or I think more precise, like the couple comes and asks, the first question is, do we both need to be evaluated or just my wife can get evaluated? So it's not like that. I think both have to go undergo evaluation because sometimes there are certain abnormalities in a male partner and sometimes there are certain abnormalities in the female partner while the other partner is absolutely normal. That is why we have to evaluate both the partners in a couple. So in male, it is very simple. We just do a semen analysis wherein we see the semen parameters like the sperm, whether the motility, that is the movement of the sperm, is normal, or whether the volume is right or no, like whether there is hypovolume or hypervolume of the semen collected. And we also see whether there are immotile sperms, that is the dead sperms, whether they are more or whether there are normal sperms or no, or whether there are abnormalities in the sperms. And most importantly, we see the count of the sperms. Usually 15 to 20 million per ml is the normal range. And so we also see whether there is any, whether they are near normal or they are very less. So just the semen analysis is done as a routine investigation or a basic investigation in the male, nothing much. Then coming to the female partner, this is the female reproductive system, which consists of uterus, the fallopian tubes and the ovaries. So most importantly that we see here is we evaluate basically all these three things. Now before understanding what do we evaluate, let's understand how the normal pregnancy occurs in a female. So first of all, every month when they menstruate for the first 5 days, the inner lining of the uterus sheds and they bleed. Then by 10th or 11th or 12th day, the ovary produces an egg when it releases. So the release of that egg is called as ovulation. So once the egg is released, then this fallopian tube picks the egg from here and then the egg waits here in the fallopian tube until there is normal sexual intercourse and the sperm has to swim across and reach this fallopian tube over here to meet the egg, which is called as fertilization. So the main fertilization occurs in the fallopian tube. Then the fertilized embryo traverses back through the fallopian tube and goes here and sits and implants in the uterus for the next 9 months. It grows in the uterus. So this is a normal process or normal phenomena of or physiology of a pregnancy. So we have to understand here for this normal pregnancy, so there could be abnormalities in the ovary or in the fallopian tubes or in the uterus. So this is how we basically evaluate a female partner. So first coming to the fallopian tubes. Now how do we check whether the fallopian tubes are normal, or what we have to check? We have to just check whether the openings of the fallopian tubes are normal. So first opening here wherein it has to pick the egg, and if there is a blockage here wherein the embryo after fertilization has to reach back. So the fallopian tube has to be open on both the ends, or if there is any blockage in between the tube, that is inside throughout the length. So how do we check this? We just do a simple HSG, which is an X-ray. So we inject a dye over here and we see whether the dye is released from the other ends, which is seen on the X-ray film. So this is a simple test which is done outpatient procedure, OPD procedure. Or there is one more which is called as SSG, saline infusion sonography, wherein under minimal anesthesia, the saline is infused here into the uterine cavity. It is pushed, and live on the ultrasound we see whether the saline comes out through the ends of the fallopian tube or the tubes. So by this we get to know whether the tubes are normal or abnormal, whether they are blocked or they are just simply open. The next we check is the ovaries. So on the second day of the periods in a female, we do certain hormonal tests like AMH, FSH, LH, and other endocrinal hormones like serum prolactin, thyroid, and whether her blood sugar levels are normal. These are all checked on the second day of the cycle, preferably on the empty stomach. So along with the blood testing, we also do a simple transvaginal sonography, ultrasonography, to see how many follicles are present in the ovary. So the number of follicles present in an ovary on the second day of the cycle also decides the number of eggs, or like whether the ovarian the number of eggs are more or less is decided. More the number of follicles, obviously the eggs are good, but not too much, which is again called as PCOD. So it should be in the normal range, that is 8 to 10 follicles present on the second day of the cycle in an ovary, which is seen on ultrasound, suggests that the ovaries are normal with the normal number of eggs. Again, if the egg count is less, and also also if the hormone levels are less, then again it is a poor ovarian reserve of the egg, or less number of eggs present in the ovary of that particular female. The next thing that we check is the uterus. So the uterus, we see the inner lining, whether there is any extra growth like polyps, or whether there are fibroids outside the uterine cavity or outside the uterus on the surface, or whether there are any fibroids inside. Plus, we also see whether the uterus is abnormal. Abnormal in the sense, sometimes there is a growth inside the uterus in between the cavity, so that the embryo doesn't get implanted, or sometimes the uterus is two uteruses are present, which is called as bicornuate or didelphys uterus. There are certain medical terminologies for that. So we see whether the uterus is normal or abnormal. So the shape of the uterus and any other abnormalities will also be simultaneously tested when we do the testing of the fallopian tubes on HSG. So these are the basic investigations or a basic evaluation that we do in a female to check what are the abnormalities. So depending on that, when we check this basic evaluation on their visit to an infertile clinic to see a consultant, so by seeing these abnormalities, one is we can correct the abnormality, and also decides the mode of treatment. What treatment are we supposed to give to the couple? If the egg count and sperm count is too less, we directly suggest them IVF. Or if the counts are normal and there are minor problems, so we just treat the problems and we ask them to go for a natural pregnancy, or simply an ovulation induction. That is, give certain medications and try naturally to get pregnant. Or an IUI is done. That is, simply take the sperms and inject into the uterus. So the basic evaluation helps us to decide the mode of treatment and also to correct the minor problems that are present in a couple. That is why it is very important to evaluate both the partners in a couple and not just one partner.